All right, everyone. I want to welcome those attending virtually here for our collaborative community health conversation regarding hantavirus this evening. I know some people are still pouring in to the meeting here, so I just want to send a personal shout out and thank you to Mono County, Inyo County, CDPH, Mammoth Hospital, and Northern Inyo Hospital for making this happen. Hantavirus, for those of us that live in the Eastern Sierra, is certainly something we have all heard about. Seems to be one of the more misunderstood and confused disease processes that we see here in the Eastern Sierra. So the goal tonight is to provide education regarding prevention, how hantavirus is contracted, if you've been exposed to mouse excretion, what to do, how we test for it as providers. Hopefully this evening we'll dispel a lot of myths and mysteries surrounding hantavirus, especially in the wake of the tragic loss of the 3 recent community members from the town of Mammoth Lakes. We are really fortunate tonight to have a group of panelists here that are all experts in various different aspects of hantavirus. I'll start by introducing myself. I'm Adam Hawkins. I am the Chief Medical Officer at Northern Inyo Healthcare District. I'm also an emergency medicine physician, and I've been practicing in Bishop, California for the past 7 years. I'll introduce the other 6 panelists that we have for you this evening. Our first speaker tonight is going to be Dr. Ann Kintrup. She's a research scientist with the California Department of Public Health. She specializes in vector-borne disease surveillance and response. She holds a Doctor of Veterinary Medicine, a Master's of Preventative Veterinary Medicine, and a PhD in epidemiology, all from the University of California, Davis. Our next panelist is Dr. Tom Boo. He is the Mono County Public Health Officer. He's practiced medicine in the Eastern Sierra since 1996 with a 7-year tenure at the Centers for Disease Control and Prevention, where he completed a fellowship in applied epidemiology and contributed to the global AIDS program in both Sudan and Kenya. Dr. Boo is also a member of the Northern Inyo Healthcare District's medical staff and provides care at our rural health clinic. Our next panelist is Dr. David Araya. He is a board-certified internal medicine hospitalist who has been serving patients at Mammoth Hospital since 2009. He completed his internal medicine residency at Case Western Reserve University in Cleveland, Ohio. Before joining the Mammoth medical staff, Dr. Araya practiced in San Luis Obispo for nearly a decade from 2000 to 2009, providing dedicated care to the Central Coast community. Luis Molina is the director of Mono County Environmental Health, a division of Mono County Health and Human Service Agency. He's a registered environmental health specialist and has been dedicated to protecting public health and safety in Mono County since 1992. His extensive experience supports a wide range of environmental health programs across the region. Dr. James Richardson serves as Inyo County's public health officer and operates a longstanding private practice in the region. Dr. Richardson is a board-certified internal medicine physician and has provided community-focused care to the people of Inyo County and the Eastern Sierra for more than 40 years. And our last panelist this evening is Jerry Oser. He's the director of Inyo County Environmental Health, where he leads programs focused on food safety, water quality, and environmental protection. Although vector control is not a core program within the county, Mr. Oser's knowledge of hantavirus risks plays a key role in supporting public education and early response efforts. He's a registered environmental health specialist and has served Inyo County since 2007. So with those introductions in mind, I'm going to kick it off with Dr. Kintrup's presentation to start.
Hi, good evening, and thank you very much. I'm pulling up my screen right now, and hopefully here we go. And share, yay. Let me get it into screen mode. Hopefully we'll get that here shortly. Let's see where, oh, here we are. All right, so thank you very much. Are you guys able to see my screen?
Yes, ma'am.
Yes, okay. We can see it.
Great, thank you.
Yes.
So this evening I'm going to talk to you, give an overview about hantavirus in California as a whole. We'll talk a little bit about what hantavirus is, where is it found in the world, and then spend a good amount of time focusing on how to prevent it. Hantaviruses are really associated with rodents throughout the world. You can see by the variety of different families of rodents here, including a bat, that these viruses are found throughout the world. And they're really found in the rodent excreta. So what we're talking about is basically rodent poop, rodent spit, if you will, rodent urine, things like that, this is how the virus is basically transmitted. And this character, Paramiscus maniculatus, or the white-footed mouse, is distributed really throughout the United States. And this is the rodent that is of concern here in California because this is the one that carries the Synombre virus. So the virus that we're talking about, the hantavirus, is one that's called Synombre virus, which also translates to virus without a name. That's how it was first described in 1993. And I like this picture in talking about its transmission because what it really emphasizes is that here you have these rodents. It rains, we get a lot of these rodents. These rodents become quite active. They make their way into people's homes. They poop in little corners, so on. And then when we clean and we aerosolize in the air, people are infected by breathing in the virus from the rodent excreta. Just seeing a mouse is not going to give you hantavirus. Just seeing rodent poop is not going to give you hantavirus. But any type of cleaning or close contact there with the excreta, inhaling, things like that, that is where it can be transmitted. And I'm just going to give some really basic symptoms. We're going to get more details later this evening. In the beginning, it starts as a 1 to 3 days after onset, a flu-like fever where you're tired, muscle aches. And then 4 to 10 days later, it develops into coughing, shortness of breath. And the lungs can rapidly fill with fluid, and with that causing a 30 to 40% mortality. So people can die, as we know, from hantavirus. Unfortunately, at this point, we only have supportive treatment. There's no vaccine or antibiotics or antivirals that are helpful for this. So really, early detection and treatment is key. To diagnose it, again, we'll hear more tonight, but in general, there's no bedside test. There's no way to walk in and say, I think I have I was exposed, maybe I that way. The way we do test for it, there's a thing called an antibody test. There's available through a commercial laboratory. Quest is the common one. And then this test is also available through our viral and rickettsial disease laboratory or other state public health laboratories for confirmation. A molecular test where we can actually detect the virus with a technique called PCR, which we can do from the blood or other parts, sputum, spit or tissues. That's also done at our viral and rickettsial disease lab. And there's other more advanced tests that are done at the CDC. You'll hear also later tonight about an assessment that can be done called a 5-point screen, where one looks at blood smear and other measures which can help to predict if this might be hantavirus. Typically, hantavirus, we've detected it all year round, and this is seasonality since 1980 when hantavirus was first detected. It was actually first detected in 1993, but we went back and looked at some respiratory cases and discovered that it was in California at least since 1980, and we detect it more often beginning in the spring and in the summer when people go into cabins or homes that have been closed for a while and start doing the big cleaning, and so that's when most people are detected. The reason why we are concerned this year is because this has really been rather unusual. We had a case reported from Inyo County first in the beginning of February, which was a fatal case, followed by another case detected in Placer County less than a week later. Mono County, and 2 others in Mono County were fatal that we detected. So this is definitely an early season or an early start to our year. So we really want folks to be aware of it and know how to prevent it. But all that being said, since we know it's been here in California since 1980, we've really only detected 100 hantavirus infections. It's a serious disease. It's a rare disease. We've had mostly male, 60% male. Age range is 8 to 78. We get maybe about 3 cases a year, and about 30% of those are fatal. And honestly, this mouse is found in rural areas throughout all of California. And hantavirus can also be found in various areas throughout California. But in terms of detecting cases where people have been exposed, we see it quite often in the high elevation rural areas, particularly in the Eastern Sierra. And we know that rodents in this area not only can be quite numerous, but they also have a high percentage of them that are infected. When we look at how people are exposed, about 40% are exposed what we call peridomestically, so around their home or cabin, so cleaning up that type of area, their own personal home. About 20% with recreational exposure. 20% may be with occupational exposure. And about 10%, we can't really tell the difference between occupational and peridomestic because people often live and work in the same location. And about 10%, we were not able to identify how folks were exposed. Here's some typical or some examples of exposure locations that we have identified as places where hantavirus was transmitted. You can see on the left, we have some very nice rural cabins, and we had a mouse infestation in this area, and an individual was exposed in this kind of home. On the right, we see a farm building where an individual was exposed, and the smaller home type situation. And then, of course, in 2012, we had exposures in Yosemite associated with a certain type of cabin that encouraged rodent nesting. When we investigate these cases, we see a lot of rodent activity, and this is a recent exposure investigation that you can see one of our biologists is dressed in preventive clothing and so on, so he doesn't breathe in the area. But the individual had come into this space who was exposed and who got hantavirus, looking for an item and moving things around. And you can see that rodents have come in and among the walls, chewed things up. You can see the rodent excreta everywhere. And then we actually posted the door to that space with a sign to warn people about that, but you can see the whole the little areas where the rodents have bitten to get in on that door. Here's another example, some other examples of exposure investigations. We can sometimes open drawers and just see them full of where little rodents have decided to make nests, and you have to clean these. We'll talk a little bit how you would go about cleaning these areas. Sometimes we see that people know that they have a rodent problem, so let's drop some glue traps. These are the worst traps that you could use. We've actually recovered these rodents and tested them positive. They can sit there and still continue to shed virus. So we'll talk about what kind of traps that you want to use in this situation. Our basic message, and we'll go a little bit into detail now more about exactly what this means, is to seal up, trap up, and to clean up. Do not sweep or vacuum. So to seal up, what are we talking about? you need to seal up holes both inside and outside buildings. Mice can squeeze through a hole the size of a pencil, very, very tiny. And so you need to prevent mice from entering buildings by sealing any gaps or holes. And you can use a variety of different materials to be used. Hardware cloth, steel wool, steel sheet metal, mortar, concrete, and expanding foam. This is very common ways for rodents to come in is in and around pipes and conduits into buildings, as well as you can see the holes at the bottom of this door they've chewed in. So these are all very common places where people can go in and be exposed to rodents who have developed nesting areas. Sealing up is really important. This is a really common place that we find entry points for rodents is right under the door sills. And you can see the light coming in right there. And so you really need to seal that with, a good coverage to keep the rodents from coming in. Really important to place firewood and wood piles, trash cans, dumpsters at least 100 feet from the building. I know it's convenient sometimes to keep it under the eaves of the house. Unfortunately, that does attract rodents to build their nests in and around there and find their ways in homes. You want to fix leaks in sprinklers and other outside pipes that might attract mice. And when placing traps, this is really important. You use the right size trap. Just a small amount of peanut butter, like the size of a pea, is really what's effective. And you place it against the wall so that the peanut butter part is closest to the wall, right along perpendicular. And you place it in the areas where there's mouse activities. You don't want to use glue or live traps, as I mentioned. And you may want to monitor, what are you trapping and what are you seeing? And even after you have excluded from the outside, you want to continue trapping. Because that makes sure that you get anything that has stayed inside the home. So the big thing about cleaning, a lot of times we wonder, well, how do we clean? Well, you don't want to sweep. That's what this big X is over this aerosolizing sweeping. So when you see this kind of thing, what you want to do is use what we call a wet cleaning method to minimize the chance. You don't want to vacuum up anything like this. That is an amazing way to be exposed to hantavirus. So the way that you do that is we encourage folks to wear gloves and eye protection. And then you spray these areas where you see the mouse infestation, the droppings, carcasses, with a disinfectant like Lysol or a mixture of bleach and water, and let it soak for 5 minutes or more. Are going to use bleach or a commercial disinfectant, be sure to follow the label instructions in terms of the percentage to use. Other things that we've had to do and encourage folks to do is to take, particularly in highly infested areas, the material outside where it can be exposed to ultraviolet sun for a few hours. And in fact, on the right, these are our biologists, and this is post, exposure and handling rodents. And we stand out in the sun for a while and dry out after we've disinfected ourselves. I really, really encourage you to check out our webpage. If you go to cdph.cia.gov and type in hantavirus, we have a lot of great information on our website. What is hantavirus, how you can get it, how you can prevent it. We got a lot of really, really good videos, as well as posters and things like that are helpful in workplaces and at home to remind you how to clean. So in conclusion, I'll just reiterate that we've had 4 early season cases that really is kind of an unprecedented number early in the year, and we want folks to be aware. It does raise concern that we want both people and physicians to be aware of this case. And when we did look for exposure, we in fact did find quite a bit of rodent evidence, which really emphasizes, and I'm really grateful for the opportunity today to talk about how easy it is or how much you need to be aware to prevent rodent incursions and really carefully clean up using the protocols I described. And I'll finish with acknowledgments to our infectious disease branch folks who do our public education, all our biologists in the vector-borne disease section, our viral and rickettsial disease laboratory who coordinates a lot of our testing, and then of course the Mono County Health Department, Placer County Health Department who helped us in these latest follow-ups. And I want to thank you all for your attention.
Thank you so much, Dr. Kimtrup. Louis, I'm gonna have you kind of provide some more information about mouse eradication efforts, especially here locally. And I just wanted to let the audience know, please put your questions in the Q&A box here. I am going to delay answering those questions or having our panelists answer those questions till the very end, just to make sure we get through all the education material, because I feel like some of the questions that are popping in there will be answered by the talks that we have coming up. But rest assured, we have a robust amount of time to do Q&As at the end. So thank you. And as you're listening to the talks, please feel free to put them in the Q&A box. But Louis, could you provide us maybe with some more mouse eradication information and kind of a more local lens?
Sure, I'd be happy to. Dr. Kimtrup certainly covered most all of the the issues and all the points. Exclusion, places where folks should be really looking when they have mice. The first places that I look and where I would tell people to look is the conduit locations, where underneath sinks, bathroom sinks, underneath kitchen sinks. So wherever you have pipes entering the wall or coming through the wall, whether it be your supply lines or your drain lines, or coming up through the cabinets through the floor in the same locations, if you have any gaps there, and I think there was at least one picture in the previous presentation, where it shows a fairly good sized gap. Now, we talked about a 1/4 inch. That's obviously very small. So something that's as small as a 1/4 inch or maybe a little larger, you could even, you could probably use a caulking material that would fill up something that small. But anything larger than that, we recommend that you're going to stuff steel wool in that space and seal it up, hold it in place with either some caulking material or some expandable foam. If it's real large, if it's getting, if we're talking an inch or larger, you may be looking at some of that hardware cloth. And hardware cloth is just basically metal screening, comes in different gauges. You'd want to make sure you get size so that you can cut that out with tin snips or with wire cutters and fit that around pipes to close off any larger gaps. And you can hold it in place with a or to some board around where the piping is coming through. So there's a lot of different techniques, but the main thing is you can use anything that's going to be held in place to fill in those gaps and stop the mice from coming in or from finding their way back into the walls. So the other thing is, if you have mice, they're going to be looking for places where they can find harborage. So even if they didn't come through those openings around pipes, they can find their way back in. So you want to just eliminate harborage. So I would just say, I talked to a lot of people, and obviously everybody's very concerned about mice, as they should be. Mouse in your house. I mean, I think most of us have experienced that. And I think the main message here is, if you've seen a mouse, if you're seeing evidence of mice, rodent droppings, nesting material, you're going to set out your snap traps, and hopefully you catch the singular mouse. If you catch them, you follow all the same precautions that Dr. Kimtrup was mentioning. You're going to wear your protective equipment, spray down the animal and the trap, throw the trap away with the animal in it. Don't try and remove the mouse from the trap. You're just going to potentially, or you're going to heighten your potential for exposure. So just spray the animal down in the trap, pick it up with your gloves on, put it in a plastic bag, and throw that away in your trash. But continue to set snap traps. After you've caught that first mouse or second mouse, keep the traps out. And that's a great way to monitor. If you go for a few days without catching mice, especially after you've cleaned up the droppings and you're not seeing any more, you've taken care of the problem. If you continue to see if you continue to catch mice, then you know you have not sealed off. You have not found their entrance point. So you're going to have to do some better investigation. And along with underneath the sink, other areas you can look. And there was another picture there of lights, lighting a gap underneath a door. I mean, that's like the one that was shown there is like a freeway for mice. So if you could close a door, it's dark inside, and it's daylight outside, you'll see a light showing through. You don't need much space. If you see any light, it's probably big enough for a mouse to get through, and that's the first place you really should be sealing off. You can do that by replacing the sweeps or the rubber seals that are underneath your door. If that still doesn't work, you might be looking at doing some work on your threshold. You need to have a pretty tight seal there. So those are some areas you can look. I'd say the last thing I would say, and I'll obviously answer questions, but the garage doors. Now, we get a lot of calls on mice in garages. And as we can all imagine, if you have an entrance from your garage into your house, it's just a matter of time until that mouse or mice find their way into your dwelling. So if you're getting mice in your garage, it's a similar situation where the garage door is closed. There are rubber strip that is at the base of your door. Those do wear out. They do get chewed up by mice, or they just get worn out. You can replace those in most cases. It depends on your door, but in a lot of cases they slide out or they screw in, and you can replace the bottom there. And the same thing, you close that garage door and you look to see if you see light underneath it. If you don't, then you've got a pretty good seal there. The corners are the areas where the mice can get around that seal. So you might have to do a little bit of work to kind of make sure that at to the house on each side, you might have to do a little more sealing there. But all the time, I have traps in my garage 100% of the time. I don't have to get mice in my house very often, but I do get them in the garage once in a while, and I'll catch them when they do get in. So those are just some tips, and I'd be happy to answer any questions when we get to that point.
Thanks, Louis. There are a lot of questions coming in through the Q&A box. So what I will ask our panelists are, if you're not speaking and you all want to answer some questions via typing, I think that might be the most efficient way to get through all of these. The answered questions from our panelists, just for our audience, if you click on the Q&A box at the bottom, it'll open up a open question tab, and then at the very top, just to the right, there's an answered question tab. So as we're presenting and talking, if our panelists want to answer the questions and our audience want to look at the answered questions, that might be the best way to get everything answered and still allow us to kind of move forward with the programming here. So panelists, if you see some questions that you can knock out while we're moving ahead, please feel free to do so, and we'll highlight some of those answers at the end of the presentation. Thank you, Louis. Dr. Araya, are you ready to give us your presentation next?
Yeah, I hope everybody can hear me well. Let me go to share my screen. Okay. So some of this is going to be a little repetitious, and just to go through the key points here. Whoops. Okay, there we go. Hantaviruses, there's probably over 20 that can cause human infection. The one that we are most concerned about is the Sonombre virus, and the infections can be severe. One of the things I want to emphasize is that even though they are severe, they're really rare. We've had about 30 cases, or just under 30 cases, confirmed in Mono County since 1993, and I believe 9 cases in Inyo County since 1993. So even though it's in the area, and we can get it by breathing in viral particles from rodent droppings, the confirmed cases have been rare. As Anne was saying, the deer mouse is the reservoir that carries the virus. The virus is shed in the urine, the feces, and the saliva. And we become infected when we breathe in the viral particles that are contained in those rodent excreta. Again, I just want to reiterate that this is preventable, or at least we can minimize the risk of acquiring the infection if we take care in cleaning up after the rodents. So, wearing a mask, specifically an N95 mask, would be efficient. Spraying the waste with a disinfectant solution, and you can make that with household bleach, 9 parts water to 1 part of household bleach. Spray that on the rodent waste, let it sit for 5 minutes. Do not sweep it up or vacuum it up. So you don't want to project any of the particles into the air and breathe it in. You just want to wipe it up with a damp cloth or paper towel. Take that waste, put it in a plastic bag, seal it, and dispose of it properly. And that's how we can minimize this. So from the time of potential exposure until the time that somebody develops symptoms, that's the incubation period. And typically incubation is about 2 or 3 weeks, although it could be maybe as short as 9 days. That was from one study, and possibly up to 7 weeks out. So the range from exposure of the viral particles, again, can be as short as 9 days, as long as 7 weeks, but typically it's about 2 or 3 weeks. And during this period of time of exposure until you develop symptoms, there are no symptoms during the incubation phase, and there's no routine testing that we can do as physicians to determine if you've been infected during this time period. After the incubation phase, you can go into the prodrome phase, which is really the early phase of infection. And the symptoms are very nonspecific. Typically, it's fever, chills, muscle aches. That's it. You can develop nausea, vomiting, diarrhea, belly pain, and that's all before you develop any respiratory symptoms. Common cold symptoms like runny nose, sore throat, ear pain, those are usually absent. So if you do have symptoms like that, it's probably not hantavirus. And this early phase, it can vary, but it's about 2 to 8 days, of these sort of nonspecific symptoms. After this, it can then go into the more severe phase, and this is the phase we call the Hantavirus Cardiopulmonary Syndrome. This is where you develop severe heart and lung symptoms. And primarily what's driving this is that the small capillary blood vessels in the lungs become leaky, and the liquid portion of the blood then leaks out from the capillaries, and it fills the airspace of the lungs, causing the respiratory symptoms. It can initially start with a dry cough, and then progress rapidly over 24 to 48 hours of increased difficulty breathing. And this can also be associated with decreased heart function. People can develop low blood pressure, blood clotting abnormalities, abnormal heart rhythms, and it can proceed to death. And again, this phase can be very rapid. So from the time you start symptoms until you can go into this more severe phase, it can be typically, I think I read it was between 3 and 6 days, but it could be a little shorter, a little longer, but it's usually within about a week or so of the onset of symptoms. You can then go into this more severe phase, and that can deteriorate rapidly over 24 to 48 hours. Afterwards, there is a recovery phase. The references say the recovery can occur quickly over 24 to 48 hours, but it can also be delayed. From us as clinicians in the Eastern Sierra, I think the key thing is if we do have somebody who is in this, who develops the severe cardiopulmonary syndrome, the key thing is to, fly them to a larger hospital where they can get more aggressive care. There are no specific antiviral treatments that can eradicate the Sonombra infection. All of the treatment is supportive. And again, it's early recognition that you've got somebody who is potentially going to decompensate rapidly, fly them to a larger hospital where they get more aggressive care. The type of care that they can get would possibly include something called ECMO, which is extracorporeal membrane oxygenation. They can do that at Renown up in Reno at their main campus. And then, there is an inflammatory component to this, but studies have showed that there's really no benefit in using steroids for the inflammatory component. For the docs and nurses out there, one of the early things that we might be able to see actually in the prodromal phase before somebody develops a cardiopulmonary syndrome is a low platelet count. And it's not specific, obviously, for the Sonombra virus infection, but it is pretty sensitive. And the platelets can actually drop quite a bit in the first 12 to 24 hours, and I'll get to that in a little bit. Other things that we can see on labs would be increase in serum LDH, and then later we can see increase in serum transaminases, ALT and AST, and increases in lactate levels. But again, all of these things are nonspecific, so it can be really hard as a clinician because we can see these laboratory abnormalities in other conditions as well. So that's what makes it tough to pick up on this early. One of the things that's come out of the, when this was all discovered in 1993 in the Four Corners region, they went back and they looked at peripheral blood smears of patients who were infected, and the presence of immunoblasts is one of the things that does correlate with Sonombra virus infection. And again, for those of us who are practicing, if immunoblasts are reported on the peripheral blood smear, that usually corresponds in timing from this transition from the nonspecific prodromal phase to the more severe cardiopulmonary phase. So again, low platelets, they can be detected early, but they do not correspond with the severity of illness. Other findings on the peripheral smear would be, markedly increased white blood cell count. Normal white cell blood count would be somewhere between roughly 4,000 to 11,000, and in Sonombra virus infection, they can rise as high as 90,000. As Dr. Kimtrup said, there is specific testing that can be done. Immunologic testing, looking at antibodies IgM and early exposure, IgG later on, PCR testing. But one of the key things here is that locally we can't do these tests. We have to get a specimen. We have to send it to a reference laboratory. So we won't get results back from these specific testing. It's going to take several days to get them back, and by then it might be it may not be soon enough to make some determinations on what to do about patients. So this is what I was talking about earlier. The researchers out of New Mexico in 1993, when this was all discovered, they went back and they looked at their patients, and what they saw was that if they look at a complete blood count and the different types of information you get from the complete blood count, there are things that stand out that can actually correlate pretty highly to the Hantavirus cardiopulmonary syndrome. One of them is the hemo concentration, which is an elevation in hemoglobin, an elevation in hematocrit, and those are measurements we do to look at the amount of red blood cells that are in your circulation. But during the development of the cardiopulmonary phase, as the water portion of the blood is leaking out from the capillaries into the lung spaces, that water is leaking out so that the blood is becoming more concentrated. So for females, you're looking at hemoglobin 16 or higher. For males, you're looking at hemoglobin of 18 or higher. Again, another thing is the low platelet count, the thrombocytopenia under 150,000 platelets per microliter. The third thing would be something called a left shift, which is predominance of certain types of white blood cells that are stimulated early on in fighting infection. So when those rise, it has a high correlation, or it can correlate highly along with these other findings. More specifically is immunoblasts. Immunoblasts are really stimulated more with viral infections than with bacterial infections. So if there's a high predominance of immunoblasts on the peripheral smear, 10% or more of your total lymphocytes, then that has a correlation. The fifth and final thing is the absence of toxic granulocytes. And toxic granulocytes you can see when the neutrophils are fighting bacterial infection. So If there is an absence of those, it strongly suggests or more strongly correlates to viral infection. But the key thing with this is that when they went back through all the data, they found that if people had 4 out of 5 of those things on the peripheral smear, it was actually very sensitive and specific for the Sonombra virus infection, meaning that this is a good test. This is, we don't have the ability to do the more specific immunologic testing like in antibodies, the IgM and IgG, or the PCR testing to confirm the infections. Those are all sent out, but the peripheral blood smear we can do locally, and that's a test that can be done at Mammoth Hospital. That's a test that can be done at Northern Inyo Hospital. Dr. Boo might be able to speak more about this, but we are working locally with experts from the Four Corners region to do specific training so that we can start incorporating these measurements when we're concerned about local patients with hantavirus. And that's, I think that's it. This just kind of summarizes thing. That 5-point screen, it's not going to be helpful in the prodrome phase because you're not going to have enough of these things developing yet. So this is really most useful in the early portion of the cardiopulmonary phase. And that's really when people are starting to compensate rapidly. So it's something where we might get the first complete blood count, and the smear may not have enough of these things, but if we repeat it 12 or 24 hours later, we might see significant changes, enough that we can transfer somebody out to a larger hospital where they can get more aggressive care before they decompensate further. And that is it.
Thanks so much, Dr. Araya.
You're very welcome.
Dr. Boo, I'm gonna have you kind of summarize the epidemiologic talk and the clinical talk here in a second, but just want to point out to our audience that there's some great questions being answered. We have 31 answered questions in the Q&A box below by our panelists, so please check those questions and answers out and keep posting any questions that you guys have. So Dr. Boo, can you kind of bring this all together and provide us a closing kind of statement on the talks we've had this evening?
Yeah, thanks, Dr. Hawkins. Tom Boo, Inyo County Health Officer. Thanks everyone for attending, and thanks so much to our panelists and to Barbara Lahan for making this possible. I guess first I just wanted to provide a bit of an update. It was super alarming that we had 3 cases in February. That's a really high number for 1 month any time of year, but especially so early in the year. And obviously we're worried that it may portend more cases later in the year when hantavirus cases in people are more common. But we've now gone a month and a half without any additional cases, so that's real positive, and my fingers are crossed. But we believe these infections are mostly preventable, and so that's why we're having this community conversation, why we're trying to get the word out about how to just notice mice in our surroundings and how to take precautions to minimize the risk. I think I'm conscious of the fact that we have a lot of questions and we need more time for question and answer. So I'm going to skip over some things, but I do just want to reiterate what Dr. Kemptrup said about that. I don't think there's cause for real fear and excessive anxiety. I mean, mice are extremely common in our area. They always have been. I'm sure hantavirus has been here for millennia, although it wasn't recognized until 1993. And yeah, we've had a total of 36 cases over 33 years in Mono and Inyo counties combined. It's a terrible disease, but the chances that anybody on this webinar, gets hantavirus is quite low, and you can make that risk lower still by being a little bit careful. I do want to highlight a few things. It seems like most of the questions we're getting in the chat have to do with mice and exposures and the home environment and things like that. And a good question about cars that I think Lewis was answering. But we've also had a lot of questions about how do you know if you could have hantavirus versus everything else? And it's not necessarily straightforward, but some really useful rules of thumb would include that if you have cold symptoms like a runny nose or a sore throat, it's probably a cold. Those are just not typical symptoms of hantavirus. Fever, 90% of people with hantavirus have a fever. So if there's no fever, again, it's probably not hantavirus. And if you have cold symptoms with a fever, it's probably influenza, COVID, RSV, something like that. Also, if a cough starts on the first day or two of illness, that's not the way hantavirus typically it manifests itself. Hanta starts without a cough. The cough starts after several days of illness when the lungs begin to be affected, like Dr. Araya was describing. Many people with hantavirus do have GI symptoms before there is cough. So if you have a fever, headache, body aches, muscle aches, and there's also nausea, vomiting, diarrhea, maybe abdominal pain, that could be hanta, although it's more likely to be a GI infection. However, if in that setting you then start coughing, the possibility of hantavirus should definitely be considered, and I would recommend that you get medical evaluation the same day. And also with hantavirus, shortness of breath often appears with the cough or a short time later. And I would just say that shortness of breath is always potentially serious and is a reason to seek medical evaluation the same day, whether it's the ER, if you can get into to one of our clinics. And just to reiterate that early diagnosis is key, but it's very challenging. And we, Northern Inyo, like Mammoth Hospital, is working to implement the hantavirus 5-point screen. And we believe that'll be a valuable tool. We hope it will save some lives over time. But you have to remember that the 5-point screen is not useful, is not positive in the first days of illness. It becomes valuable only when the pulmonary phase starts, when people have that cough and shortness of breath, when the lungs are involved. But that's okay, because that's a time when we need to identify these infections so that people can be transferred to a higher level of care in case they need that extracorporeal membrane oxygenation that Dr. Araya mentioned, or ECMO. And just to reiterate that low platelets it's the only lab abnormality that consistently starts earlier in the illness, but low platelets by themselves are useful, but not enough to go on. I think I want to pretty much end there, but I'm happy to take any questions, with the rest of the panel momentarily. And again, just want to thank Barbara and her interpreters for watching the chat if you would like to submit questions. Thanks.
Yeah, so a big thank you and virtual applause for our panelists and presenters this evening. I definitely learned a lot about hantavirus. I think the main categories that the questions that we're seeing fall in, there are two different categories. There's the clinical component, kind of what to do if you're sick, how we test for it, do we have the resources to treat it, do comorbidities play a role, and then there's the environmental bucket as well. So prevention, certain activities that are higher risk. So I think I will start with the clinical questions. So there's a lot of questions about patients. If you're a patient and you have medical comorbidities, so things such as high blood pressure, asthma, diabetes, coronary artery disease, does that make you higher risk for developing or for contracting hantavirus and then going on to develop Hantavirus Pulmonary Syndrome, which is the deadly kind of respiratory failure end of the spectrum of the disease? So Dr. Araya or Dr. Richardson, I don't know if either of you want to handle that question.
Well, I guess I could answer that, try to, and Dr. Araya could fill in. If you have some comorbidities, especially lung disease, and you do contract a lower respiratory tract infection that compromises your ability to oxygenate your blood, yes, you are going to have probably a more difficult time dealing with the disease. That's something we noticed and dealt with during the pandemic with COVID-19. If you had comorbidities, you had a higher chance of complications. So it's always important to look at those patients individually if they do have comorbidities. But again, anybody that presents with a cough and shortness of breath and a fever has to be evaluated quickly, especially if they have a history of exposure to mouse droppings. They have to be watched carefully. Like Tom Booth said, the 5-point system to look at the peripheral blood smear isn't useful or that useful at the beginning. But if you have somebody that's acutely ill, you need to do serial testing and monitoring. And if you start getting suspicious about something you can't handle here, then you should be thinking about making contact with Renown. They do have ECMO. I talked to the hospital liaison, and the ECMO is up and running. They do not have pediatric ECMO. They have adult ECMO. Anything you want to add to that, Dr. Raya?
No, I agree. I mean, comorbidities in general, whether it's, diabetes, heart disease, lung disease, all of these pre-existing conditions, have the potential to make an acute infection, pneumonia of any kind, whether it's a bacterial pneumonia or viral pneumonia, they have the potential to make it worse. Aside from generalities, I don't know if there's enough data, from the early 1990s from New Mexico that correlates specific comorbidities to specific outcomes. Tom, I don't know if you're aware of any of those things.
I'm sorry, Dave. I was typing an answer to a question.
Well, I was just saying, with respect to specific comorbidities affecting the severity of cynomolgus infection, I'm not aware of specific data that came out of the Four Corners in the early 1990s. But I was agreeing with what Dr. Richardson was saying, is that many comorbidities, diabetes, heart disease, lung disease, will often make an acute infection, or have the potential to make acute infection, more severe and worse in general.
Yeah, definitely agree with that. I will say that we definitely see it in young, relatively young people in the prime of life. Robust people get very severe hantavirus disease and die. So I think it can affect a broad spectrum of people. Dr. Kemptrup, any specific epi details on that stuff?
Yeah, I was just going to add from our epi numbers. The underlying conditions may complicate treatment in particular, but it is rather disturbing that some folks in the prime of life are really more affected in some of these homes than older individuals who you think might be affected. So something everyone should be aware about.
So I think this dovetails nicely into a theme that a lot of questions that both we got before and in the chat. And there are questions related to, a lot of them are related to Mammoth Hospital, but I can tell you that the resources at Northern Inyo Hospital or Northern Inyo Healthcare District are identical. So it goes for both health systems in Inyo and Mono County. But the question is, do our hospitals have the resources, or are we equipped to deal with hantavirus? And I think, I'm assuming, that the question is really, are we equipped to deal with the catastrophic effects of Hantavirus Pulmonary Syndrome, the end stage of the disease? Dr. Richardson, you mentioned ECMO. Do you want to provide just a high level explanation of what ECMO is, and if we have that, and why we do or do not have that?
Okay, thank you. No, we do not have ECMO, which is extracorporeal, meaning outside the body, membrane oxygenation. And basically what occurs during that process is that the blood is recirculated through a oxygenation machine and then returned back to the body with fully oxygenated blood to bypass the lungs, which are compromised in oxygenating the blood under these circumstances. It has been shown that if you get to a patient soon enough and get them on ECMO, that you can improve their survival curve significantly. The ability in Renown has, like I said, has the adult ECMO machine. Now, I don't know what the difference between the adult and the pediatric level is and what the age cutoff, but after discussion with the hospital liaison, they said that they do have the ECMO for adults. And we do not have those capabilities. I mean, if you start thinking about it along those lines, the patient should be in their hands so they can make that decision. You have to get to the patient early. The problem with decreased oxygenation, you get into some organ failure, the heart will start failing, your blood pressure falls, you need to have increased pressure monitoring. You need to have somebody like that. If you get concerned to the point that you're worried about the ability for them to turn around under normal circumstances, like maybe a viral pneumonia, other than Hanta, you need to have that patient up there. And at that point, you probably should be doing the 5-point correlation on this peripheral smear. And if you were thinking about having Hanta treatment in outside hospital, that system probably would be positive, at least 4 out of 5 of those parameters, which increases your predictive value, 4 of them, by 90%, positive for Hanta. We shouldn't be trying to treat, if we have a known Hanta, we should not be trying to treat it here. They should be monitored closely and have the availability of ECMO at a moment's notice.
Thanks, Dr. Richardson. I'll add that I spoke with Renown yesterday as well. So Renown's ECMO program is relatively new. They started it about 8 months ago, and they have 2 ECMO machines, so they can put 2 patients on ECMO at a time in their system. They estimated that they were going to do 12 patients the whole year for ECMO. So that just gives you an understanding of how it's not a common procedure. Hantavirus is not the only reason to put someone on ECMO. Anything where the lungs have shut down and you need to bypass the lungs is a reason to put someone on ECMO, broadly speaking. But it's not it's incredibly resource intensive. It requires highly specialized physicians and surgeons to perform the procedure. And even Renown, who's our largest metropolitan area or closest to us, at least without the mountain range in between, that huge metropolitan area only estimated 12 patients per year. So we don't have the resources here to be able to support that program. The next clinical question that I think I want to add, and Dr. Araya, maybe you'll be acutely able to answer this, is you mentioned that this 5-point screen can be used. So, if a patient feels sick, they don't feel well, they have cold and flu symptoms, or they're just febrile and body achy, maybe they're having a little bit of, they feel like their breathing could be a little more labored than normal. And they come to the emergency department, either in Bishop or up in Mammoth. And can you just define what you mean by sick? Because you said that we have this 5-point screen, but it's really only helpful when patients are sick. And I think there's a difference between feeling sick and then like the medical objective definition of what sick means. Can you kind of paint us a picture of what you mean by a sick patient and when that 5-point screen is going to be useful?
Yeah, so again, the 5-point screen is not going to be useful in the early phase, that sort of non-specific viral phase, the prodrome phase, where you may just have fevers, muscle aches, maybe some gastrointestinal symptoms like nausea, vomiting, diarrhea. It's really going to be helpful when the disease is transitioning from that early phase into the more severe phase, and so it's like that 24 to 48 hours. So I would say, for people that are just having mild symptoms that are very nonspecific, we're never going to be able to determine anything with routine laboratory testing. That 5-point screen is really going to be helpful if you're in the early phase of the acute cardiopulmonary syndrome. And by then, I mean, you're going to be having a hard time breathing. You're going to have significant respiratory symptoms. You may have been sick for 3, 4, 5 days, but then in the last 24 hours, you got substantially sicker. I would say for the people that are asking questions of when they should come in, I mean, obviously, if you're having severe symptoms, by all means, come in. I think the mild symptoms is really going to be the hard part for all of us, whether we're in the emergency department or we're in clinics, because if people are coming in with mild symptoms, we really don't have good testing, to determine if this is something just routine or if this really is a Sonombra virus infection.
Thank you, Dr. Wright. Well, I think I'm going to kind of transition us over back to the kind of exposure and mice side of things. So there's a question that came in about how dealing with mice and mitigating mice maybe around your home or your place of work. And there's concern about, someone was hoping that we could talk about how to deal with these vectors without using chemical rodenticides. And I think we talked about that with the mouse traps, but are there any products that are safe to use, any chemical products that are safe to use to eradicate mice, and how do you all recommend going about that? Maybe that's best answered by Lewis or Jerry.
Well, I can answer it. I mean, I think we do want to stay away from using baits. I think for a lot of different reasons, but it's been shown those poisons are going to find their way into the food chain of other animals. So or your own animals around your house. So we really want to discourage you from using decon and other baits like that. And maybe Dr. Kemptrup could add to that. I don't know if there's other pesticides out there that would be safer, but I think snap traps, in my experience, snap traps are extremely useful. They're successful and effective. So I think if you are setting them properly, you're setting enough of them, and you have to be eliminating the entrance points of the animals. I mean, you could trap for the rest of your life, but if you don't stop the mice from coming in, they're going to keep coming in. And I don't know if it was mentioned, but already, but mice do follow the scents of previous mice that have found their way in. So once there's been an entrance point where the mice are coming into a building or a structure, more mice are going to follow right after them. I have caught a mouse in a trap. I put traps under my truck hood, always have a mouse trap there, and I catch a mouse there every few weeks. And I spray it down with bleach. I spray it down with everything, and somehow a mouse seems to find its way back in there. So you just have to be diligent. And if you do find the entrance points, mouse traps, snap traps are going to be your best bet.
Nothing to add to that. Lewis, I like sometimes those snap traps that are cat scents, because some people are worried about, and I've actually had pretty good efficacy with those, but they really have to, the other big thing is to make sure that they're mouse size, because you could use the rat ones and the mouse can just go right over it. So there are options for, to keep your cat from getting hurt or something like that. But they're snap traps. You need to, that's really the best way.
Dr. Kemptrup, I'm going to ask you this question, but Lewis or Jerry, please feel free to chime in. Someone wrote in, is there ongoing testing or sampling for hantavirus in mice and other rodents in Inyo County and Bishop? And I think the same can be said for Mono County. And I think the main point is, not just related to after exposure. Are we actively monitoring this?
Yeah, great question. And we are indeed. We our biologists at the vector-borne disease section will go to many areas in these high Sierra areas where people may be exposed, whether it be at state parks or on some various forest lands, and we do ongoing monitoring in certain areas in addition to case follow-up. That data is actually all on our website. So as I mentioned, if you go to cdph.ca.gov and you type in hantavirus, we actually have a story map there that has a lot of great information, not only on hantavirus itself, but as you continue to scroll through it, you can see a map that shows what we have found in these various counties. And we have found that for whatever reason, at the higher elevations, a higher percentage of these mice are infected compared to other parts. Typically, we see 15% around the around California. And in Mono County, we've gotten up to 25%.
And I would just add, Inyo County Environmental Health, back in the early 2000s, mid 2000s, we were going out and doing surveillance trapping and sending blood samples in to be tested, and it was pretty common to find at least some prevalence in whatever we were catching, deer mice, I mean. So we were doing it, and it just came to a point where, yeah, there's definitely hantavirus here. Let's more just get the word out on how to stay safe from rodents. So
There's also,
Yeah,
oh, go ahead.
I was just going to say, I will also add, we do get calls periodically, people, asking, if I catch a mouse, will you have it tested? We don't do that. We just don't have the resources to be sending off mice. And I think as a general rule, the state lab doesn't want to be, having mice sent to them. But with that said, it would be of, I don't know if I want to say if it's a little value. It would be of limited value because the mouse that you're catching today, whether it's positive or negative, is not going to tell you what the next mouse is going to be. So as we've mentioned, we want people to just basically treat all mice as if they're positive. So, if you caught a mouse, treat it as if it's positive. Sending it in and finding out whether it was positive or not is not going to change what our message is going to be, because there's always a potential for any mouse that's getting into your house to be positive for hantavirus.
There's a theme of questions kind of related to, I think you guys have covered the obvious exposure activities, walking into a non-ventilated attic, shed, home where you're stirring up obvious kind of rodent material, but there's questions surrounding more seemingly benign activities like gardening, even mountain biking, or doing some like brush clearing, or where mouse activity can maybe be assumed but is not obvious. Is there any protection that you all recommend doing these kind of routine daily outdoor activities, or how can our community members?
No, don't worry about it outdoors. I mean, there might be certain situations where, I think Anne has told me about one case in California that they believe infection occurred outdoors. It was very, sort of unusually dusty situation or something like that. But this is really an indoor problem.
Yeah, the key is an enclosed environment. And so 99.9% of our cases are, going into buildings, going into enclosed spaces.
Yeah, and I would just add, I mean, there was a question earlier about in the chat from somebody who has mouse infested hay barns and storage and stuff like that. And if that's a large airspace and fairly well ventilated, that's going to be relatively low risk, but not no risk.
I'm going to jump back onto the clinical side really quickly, so forgive me for for jumping around a little bit, but there's a lot of questions about testing. So we went over the 5-point screen, but Dr. Kintrop, you mentioned in your talk, and I think all of you are probably able to qualified to answer this, but there was mention of an antibody test. So can you explain what an antibody, maybe not the science behind what an antibody test is, but what do antibody tests tell the providers that are ordering them? And can patients, can we get antibody tests here locally? And then what clinical utility are those for our patients?
Right. So when you are exposed to an infectious organism or any organism, your body is going to respond and try to fight it off by making what we call antibodies, which surround the organism and, help your cells eliminate it. And when that happens, we can detect those those molecules that are made. And there's two responses that your body makes when you do that. One is a very early response, which we call an IgM response. And the second is one that comes later and last, which is the IgG response. It's why we give you a vaccine for certain diseases, but for hantavirus, and to detect it and to say it's confirmed, we want to be able to detect those antibodies, but only the early ones, the IgM ones, when you are sick. That's when we know that why you are sick is because of hantavirus. And maybe another way I can help answer it is we have had people now after hearing this saying, wow, I had a respiratory disease after being exposed to mice last year. I wonder if I had hantavirus. Can I get tested for it? We can test for that IgG, but it's going to tell you nothing. All it tells you is that if you got it positive, maybe you were exposed, maybe that's what caused the disease. So really, the only way that we can test and say you have hantavirus is when you are sick. And I hope that helped. And anybody else, please jump in and add to that.
Dr. Booth, go ahead.
And this is Jim Richardson. Can you answer the question on the timing for getting these tests? In other words, if we got an IgM and it was positive, would we want to go back and get a PCR to confirm that? Or would you feel comfortable with the IgM if it's positive in making the diagnosis?
Right. So in many cases, we've just been able to get the IgM. And if we had a person who was sick and we had a positive IgM, then we call that a confirmed case. But we do typically try to do a PCR as well, because we can do more things with that information. We can get the genetic sequence from it. We can match it to mice in different areas. So we have been able to, with that additional information, help us identify where people were exposed. Sometimes we don't get the real story, and we have found the real story from molecular information. So the molecular test is very helpful to do additional investigation. And sometimes it's the only way we can detect the virus from other tissues. Like, for example, we can't do a titer or an antibody test on lung fluid, for example, but we can do a PCR. So these are both tests that are important for different situations.
Dr. Boo and Dr. Richardson, do you know, are local providers able to order this test, or are these tests that need to be approved through the respective counties, the antibody tests in particular?
Yeah, Tom, go ahead.
Yeah, so I mean, Dr. Kemptrup mentioned that these tests are available through the commercial laboratory side, Quest, and anybody with a medical license can order, an IgM, IgG combination test through Quest Labs. I mean, if the IgM was positive, they would automatically send it to VRDL for confirmation. But yeah, no, I think in general, anybody can order test through the state lab, but best practice would be to talk to me or to Jim. It's a very time-consuming, resource staff intensive test to do. It's not going to be immediately clinically useful in determining whether the person needs to get on an airplane to UC Davis or someplace. And the 5-point screen is going to give you more information clinically than a send out test. One other reason for that is that if the VRDL is informed ahead of time that there's a suspected case and the specimen is coming, they can prepare for it. They can do some of the preparatory work for the serology testing. It'll decrease the turnaround time. So people can order the test without our permission, but it's best practice to give us a call.
So it sounds like our community shouldn't expect a similar to maybe like a flu or a COVID test, that it's going to be an easily obtained test.
Okay.
Your primary care doctor is going to order it routinely just out of kind of to satisfy a curiosity.
Yeah, no, that wouldn't be appropriate. And there've been some questions in the chat. I'm glad we have a chance to try to answer this live. But will we ever have point of care testing. We've got these great, PCR tests, all over the place now for like COVID and COVID and flu and COVID and flu and RSV. But, we have a market-driven healthcare system, and there's just not going to be the demand, the market, for some company to invest millions of dollars to develop a test for, a disease where there's, 2 or 3 cases in California a year, and we're the most populous state in the country. So. And same with vaccines. I mean, it's so rare. I mean, it's so uncommon, the disease. I mean, would you immunize everybody? But no one's going to develop a vaccine for it because there just would not be a anticipated market for it.
Yeah, I agree with you, Tom, that using the antibody screen, if you have a patient that you're concerned about, and you're using an antibody screen to try to make the diagnosis, the turnaround time is going to be too long for you to really make an accurate decision. I think, like you said, the 5-point peripheral smear is probably a better way to get a predictive value. You could have that done on the spot. Our lab is gearing up for that, and apparently it is available through the lab director. So that's probably the best approach, and not an antibody screen. The time turnaround for antibodies is probably 2 days at least. And that would probably, if it goes to Quest or LabCorp, it's going to take at least 2 days. You could lose a lot of time in ground making a decision.
Well, we are getting close to our time limit here. I want to give our panelists an opportunity to kind of provide any closing comments that you might have, or fill in any gaps that you think we weren't able to cover. I apologize to the audience members that asked questions that we weren't able to get to. But after I give our panelists a moment to kind of wrap up here, I will try to do some housekeeping about where you can find this recording and potentially answers to the questions in the chat. So Dr. Boo, maybe we'll start with you if there's anything you want to close with.
Yeah, thanks, Dr. Hawkins. I don't have any prepared closing remarks, but again, I think I would just thank people for attending. We want people to understand more about this virus and to just be aware of mice in your everyday indoor surroundings and take simple precautions. I mean, this is something we can live with and we can prevent. I hope we don't have any more deaths this year. So please be careful, but don't panic.
I'm just going to go down the panelists by how I see them on my screen. Jerry, do you have anything from the Inyo County Environmental Health side that you want to close with?
Not really, but if anybody does want to give Inyo County Environmental Health a call, I'd talk to you about whatever you wanted to talk about hantavirus wise. So yeah, feel free to give me a call.
Thanks. Dr. Kimtrip, thank you so much for being here. I certainly learned a lot, and I know our community's benefited tremendously from your knowledge. Is there anything that you feel like we missed or you wanted to kind of close with?
I'll just emphasize the numbers game, right? As an epidemiologist, that's the game I play. And, it's preventable, and I'll reiterate our website, cdph.ca.gov, and look up hantavirus. It's got a lot of really good information and videos that are helpful.
Thank you, Dr. Lewis, how about you? Anything from the Mono County side you want to finish with?
I'll just reiterate what Jerry just mentioned. Anybody can feel free to call environmental health, and I'll talk to you specifically about your issues. And we're happy to try and brainstorm with you what you might try. I see a lot of frustration, or hear a lot of frustration in the questions, as well as on phone calls, people trying to get help to solve their particular problem, asking if we have, we can recommend folks, and we really can't do that. I can't recommend different businesses, but I do encourage people to go online, try and find the pest control services you need, as well as contractors and handymen as well can help out on a lot of this stuff. They have to be knowledgeable. They have to be aware of hantavirus. You don't want to be hiring people who are going to put themselves at risk. But I think there's a lot of folks out there who can help you out to seal off your areas, to hunt down the areas where maybe the animals are getting in. And I think the average person you don't have to be very handy, but I mean, if you protect yourself and you go and look in some of these areas, you can do a lot of work on your own and seal a lot of these areas off and find that you've been pretty effective in what you've done. So feel free to call me, call Jerry. We can talk you through your individual problems and maybe we can find some solutions.
Thanks, Lois. Dr. Richardson, I always appreciate your insight on this. I know that I've personally called you a few times clinically over the years while working in the emergency department. So anything you feel like you wanna hammer home or that we missed?
No, I'd just like to reiterate what is taking place now. As the health officer for Inyo County, I'm open to calls 24 hours a day, 7 days a week. And I have received several on hantavirus from the public and also physicians. One was from a pediatrician and one was from an emergency room doctor. So I'm always available for at least assist the public on helping them so they don't panic. They need a sense of security and some guidance. And that's what I usually provide them, and to really point them in the right direction for medical care. And as far as the physicians, I'm happy to discuss cases. And hopefully this lecture has provided the providers and physicians a lot of good information that they can put to a real practice.
Thanks so much. And Dr. Araya, anything you want to close with the clinical side from Mammoth Hospital point of view?
No, just again that, an ounce of prevention is worth a pound of cure. Like everybody said, this is something where, if it's not outright preventable, at least we can reduce our risk to exposure, when we're cleaning up after rodents, whether it's in the household or in the garage. So I think that's really the key thing that I would like to emphasize is, people are cleaning up in their households, exercise caution, and that can go a long way to preventing getting sick to start with.
Thank you. Well, again, I can't thank our 6 panelists enough. And obviously, I want to give Barbara Lahan, the Marketing and Strategic Director at Northern Inyo Hospital, a huge thank you. And our thanks to our translators that provided the Spanish translation this evening. You all will see in the chat that Barbara Lahan said that the YouTube link will be up on Northern Inyo Healthcare District's website. So if you have any community members or anyone that you want to share this talk with, the recording will be on our hospital's website, hopefully by tomorrow. We'll also try to post the questions and answers. So there were 77 answered questions tonight that we'll try to compile and post in a searchable way. And then for best information, cdph.ca.gov and search hantavirus. I will say, Dr. Boo is trying to set up a talk with an infectious disease specialist out of University of New Mexico. That's going to be a little more clinically focused for the providers in the area. We're hoping to have the details of that out, and we're still working out if it's going to be available to the public, but we'll try to make it available to the public. So if you're a member of the public and you want to deep dive into the clinical management and kind of pathophysiology related to hantavirus, we'll have that information for you all shortly. But with that being said, thank you all for attending tonight, and stay safe out there.
Thanks, y'all.
Thank you.